Yes. So the suggestion is in yoga, you breathe through your nose. I've worked with yoga instructors internationally. I've taught yoga instructors from India. And there is a link with this work and the ancient pranayama, which would be suspension of the breath. And that would be, say, breathe in for so many counts, hold your breath for so many counts, and exhale for so many counts. And during that time, your breathing volume will be reduced. I would like to point out, though, I think a lot of Western, I'm sure if you're a yoga teacher, you're a wonderful teacher. But I often ask people who come into my courses, when you do your yoga, can you hear people breathe in the class? And they tell me yes, and I say, please don't do that. Because you shouldn't hear breathing in a yoga class. It doesn't make sense to go to a course to breathe heavy. When you breathe heavy, your blood vessels constrict. That's why mouth breathers are tired all the time. They're tired not because of oversaturation of oxygen, but for under delivery of oxygen. I'll point this out to you. Normal breathing is 4 to 6 litres of air per minute. The bottle there is 2 litres, okay? And that will equate to about 10 to 12 breaths per minute. At that, your blood oxygen saturations are between 95 and 98%. You can't bring any more oxygen in. People with respiratory complaints breathe 10 to 15 litres of air per minute. They breathe 3 times more than the norm. It's not adding any more oxygen to the blood. It's already optimally saturated. The question to ask is, how do you get oxygen to be released from the red blood cells to the tissues and organs? And the answer to that is carbon dioxide. 4 factors. Carbon dioxide, increased temperature, dysphosphoglycerate, hydrogen ions. They're very related to acidity. If you're breathing heavy and you're going into yoga and you're taught to heavy breathe, you're losing carbon dioxide. And as a result, oxygen sticks to hemoglobin, is not being released. The heavier you breathe, the less oxygen is being delivered. The heavier you breathe, the more of the effect it has, an vasoconstrictive effect. It causes the carotid artery to the brain to constrict. And depending on genetic predispositions, with some people they can have 50% constriction of blood flow to the brain as a result of heavy breathing. How does your head feel when you pant? How does your brain feel when you pant? How does your brain feel when you breathe heavy? Some of you will know, you will have dizzy. So you're not getting dizzy or lightheaded from oversaturation of oxygen. Your heavy breathing is causing your blood vessels, the carotid artery to constrict, and also reducing the release of oxygen from hemoglobin. So the heavier you breathe, the less oxygen being delivered. During meditation, your breathing volume, metabolism, and everything will drop. And that will slow the mind. You're focusing your breath. It's anti-stress. You will also have better vasodilation and better release of oxygen from hemoglobin. But if you go into somebody who is talking about breathing, and especially I listen to some people on radio, deep breathing, doesn't make sense. If you hear somebody breathe, or if you're told to take a deep or a big breath, don't. Chronic hyperventilation is linked to anxiety. I spoke there earlier about heavy breathing causing the carotid artery to constrict. I've written a book called Anxiety Free. I wrote it 2 years ago, and it's a very popular book. It shows physiologically the changes occurring from heavy breathing, and it will also help your main state of mind. Tachycardia, racing pulse is, if you look at a paper, it's called Hyperventilation, the Tip of the Iceberg. This question was related to having a racing pulse, 200 beats per minute. Is it related to open mouth breathing? There could be other factors involved. But chronic hyperventilation may be, I'll give you a case. I know I seen this lady here doing sighs earlier on, and her shoulders were lifting up. We had a woman coming in a few years back, and she was doing the same. She was coming in as a nasal breather, and all she was doing was sighing quite frequently. Her resting pulse was 90 beats per minute. We eliminated the sigh and calmed her breathing volume and brought down in a week to 60. It mightn't be the answer, but there could be a link.
It's on the right side.
But if you look at the paper Hyperventilation, the Tip of the Iceberg by Claude Lom, you'll see that listed as a symptom of chronic hyperventilation or overbreathing.